A 64-year-old woman with knee osteoarthritis comes to the physician for follow-up examination. She reports significantly improved pain control use since starting celecoxib 1 month ago. History of involving which of the following condition is most likely to explain administration of this drug instead of another non-steroidal anti-inflammatory. So patient is given celecoxib and the answer is it's also useful and in Glanzmann thrombocythemia. Okay, remember all other conditions like myocardial infarction is a side effect of celecoxib. So we should not give celecoxib to who has a history of myocardial, and it also has a sulfur in it, so it can cause sulfur drug allergy. Rey syndrome, we can give acetaminophen, that is also NSAID, but we cannot give aspirin. So this cannot be the right answer. In gout, we can give NSAIDs. Remember. So one of the pathophysiology behind it is against in this condition, Glanzmann thrombocythemia, patient have decreased GP2A 3B surface protein. So this means there is a defective platelet aggregation. There is a defective platelet aggregation in this patient. So if we give any NSAIDs, remember NSAIDs also block thromboxane A2, T thromboxane 1. So this can also decrease platelet aggregation. So this can all precipitate the severity and the disease in the Glanzmann thrombocythemia. Let's go through the notes. So you can see here, this is the arachidonic acid pathway from phospholipid from cell wall. It breaks down into arachidonic acid. And remember, non-selective NSAIDs, they block COX-1 and COX-2, while celecoxib only blocks the COX-2. So if we give non-selective NSAID, it can block TXA2, and this can decrease the platelet activity. Remember, NSAIDs can also block PGI1 and PGE2, causing decrease in GI cytoprotection. COX-2 is also helpful for decreasing pain, fever, and inflammation. So if we block only the COX-2, which celecoxib does, this pathway is unaffected, so platelet activity remains same, which is very useful in any platelet disorder disease. Okay. Remember, one of the option was Rey syndrome. Rey syndrome is commonly seen with aspirin use in young children, but furthermore, acetaminophen would be administered in these children to avoid risk of Rey syndrome. It's only seen with aspirin use in young children. Okay. Celecoxib, you can see it's reversibly and selectively inhibits the COX-2. You can remember as celecoxib, which is found in inflammatory cells. You can see which is found in inflammatory cells and vascular endothelium, and that blocks the inflammation and pain, which also spares the COX-1, which helps to maintain gastric mucosa. So Celecoxib is given in who is having any GI distress, severe GI distress due to using non-selective NSAIDs. We can give celecoxib. But remember, there is a more adverse effect. It increases the risk of thrombosis, causing MI and stroke, and it also has sulfur allergy. It also spares the platelet function via TXA1 production, and that is dependent on COX-1. It's clinically used in rheumatoid arthritis and osteoarthritis. Okay. One more point, gout, that is caused by impaired metabolism and excretion of uric acid. You can see some NSAIDs such as aspirin decreases the clearance of uric acid when taken at typical analgesic or anti-inflammatory doses. Celecoxib may be preferred as anti-inflammatory agent in gout, but anti-uric effect of other NSAIDs is not clinically apparent. So there is no relation, there is no problem with using non-selective NSAIDs for gout above celecoxib.
Thanks for watching. Please give a thumbs up and subscribe for more.